Hi, today from Sakra World Hospital, Bangalore. Here we have with us our expert doctor Ashok, a senior consultant ENT, to discuss all your query on hearing loss. Good afternoon, ma'am. Welcome to our live show. Doctor, here are a few questions from our viewers on hearing loss. What are the common causes and risk factors associated with hearing loss?
So commonly when a person tells about hearing loss, you would think that there was some infection in the ear which is causing that hearing problem. So there can be a hole in the eardrum, what we call as a perforation, or there can be middle ear infection. So that is the commonest form of hearing loss in children and also in adults. But nowadays we have seen a change in the trend. As the usage of phones and also the noise levels in the environment has increased, we find a lot of people coming with ear problems like hearing loss or tinnitus, that is ringing in the ear, and disturbance in hearing. So the lifestyle changes are bringing all these changes now. So noise induced hearing loss is one of the commonest cause nowadays.
My next question is are there specific lifestyle choices that can contribute to hearing loss?
So, like I told, because of our lifestyle changes, now almost everybody has not just one or two mobile phones. We use earphones, headphones for as a student also and during work because majority of us use all those devices and work related also. So the noise levels have increased and also usage of phone has increased and other forms of hearing devices. So this causes an impact on our hearing and the nerve cells. So our ears exposed, continuously exposed to radiation and also the sound level because once we start using these hearing devices, we don't realize that the levels are very high. So we start listening to music and other forms. So volume can be high and there's constant impact on the nerves and the nerve starts becoming weak. So lifestyle related, yeah, this is one thing. And another thing is there's lot of noise in the atmosphere itself. There's loudspeakers, there are the pubs where it keeps very loud music. All restaurants have so much of noise levels that also impacts the ear.
Okay. What preventive measures can individuals take to protect their hearings?
So I think as a lifestyle change itself at a personal level, we can reduce the volume or decrease the use of phones, decrease the usage of earphones or headphones when you're attending to calls and at work scenario. But also we should make an attempt to reduce the ambient noise levels in and around in the house and outside also. When we blast the loudspeakers, that not just impacts us but also our neighbors and the society at large. So even the children are getting exposed to so much of loud sound. And also in the restaurants also, maybe you should make an attempt to tell them to reduce the volume because we are at harm at the receiving end when you're sitting in a restaurant and listening to very loud music. Okay. Also in marriages and everything, we should try to reduce the level. Okay, we enjoy it, but keep the volume a little low so that the ear is not impacted.
Okay. Are there specific activities or environment that should be approached with caution to avoid hearing damage?
Another thing nowadays is all these adventure sports and activities when you do. So when you go scuba diving and snorkeling, when you have a respiratory tract infection, then there are chances that the ear gets affected because there will be severe change in the pressure in the middle ear and that causes a hole in the eardrum or it can even affect the nerves in the ear and there can be permanent hearing loss. So when you have cold, you have to be careful that when you do these activities. The other thing is in aeroplanes, when you're taking a flight when you have cold, because nowadays there's so much of viral infection post-COVID. Lot of us have stuffy nose and nasal discharge, coughing. So that also will get impacted when you take a flight. So during the altitude change, during takeoff and landing, specifically when landing, when there's pressure change, there will be severe pain in the ear. and that will affect the ear. Not just the retraction of the eardrum, what you call, because of negative pressure, sometimes there is severe damage to the inner ear. So these are the additional thing because of the recent lifestyle change which can affect the ear.
Doctor, can you explain the various types of hearing loss and how they differ in terms of causes and treatments?
So when you look at the ear, there are three major parts of an ear. One is the external ear, where the ear canal is there, and then the middle ear comes, which is a closed space where the eardrum is there and the small bones are there which help in transmission of sound. And the deeper part is the nerve which help in hearing. So each part has different activities or the function, and also the hearing loss also is different. Simple, when a child has wax in the ear, there can be hearing loss. But when there's a hole in the eardrum, that's the middle ear part, there can be fluid inside the ear, there can be hole in the eardrum, what I told, or when there's pus formation, recurrent cold coughs, we can have hearing loss. But these are all treatable conditions. When you treat the cold or whatever fluid is collected, or when there's a hole also, we can operate and close the eardrum. That improves the hearing. But when there's a deeper damage, when the nerve gets affected, then if it's in the initial stage, sometimes when you get exposed to very loud sound like a cracker blast or the loudspeaker, you can feel that numb feeling in the ear, and then slowly a hearing improves. But if it is not improving, you need immediate treatment in the form of steroids and other medications to reduce the swelling in the nerve. But if you don't treat immediately, it can be a permanent hearing loss, which will be facing it all throughout your life, and there's no medication to improve. So that way the treatment varies, and when you have sudden hearing loss due to exposure to sound, you need immediate treatment. Within few hours itself, if you treat, it can revert back to normal, otherwise there can be a permanent loss.
Okay. How does aging affect hearing, and are there ways to mitigate age-related hearing loss?
So age-related hearing loss is called presbycusis. So with age, there will be degeneration of the nerve cells, and which causes hearing loss. So every part of the body goes through aging. There is a slow degeneration which happens, like when you get old, there can be cataract formation, memory loss, like that the nerve cells of the hearing also gets affected. But it's a very slow process, and majority of the old age people or elderly people won't realize that they're having hearing loss. But somebody else might tell, I have told you so many times, or maybe they themselves, they might feel certain words they're not picking up. So this is a slow process, and naturally it happens. But if you have problems due to that, then we have to treat it. And this can be prevented, one, because elderly will have hypertension, diabetes, some other issues, general health issues. If we treat it properly, whether the sugar is under control or hypertension is under control, if you have any vitamin deficiencies corrected, then the reduction in the hearing loss is very slow, and that doesn't impact them. So we can take care of your health, and that's why, in that way, prevent the hearing loss also.
Are there early signs of age-related hearing loss that individuals should be aware of?
Usually, when you have hearing loss, that's what the person who's having hearing loss may not really know about it unless it's very specific when he's a musician, or is very aware that there are certain frequencies that he's missing. When you are using musical instruments, you can make out the different tunes, or whether it's a low frequency, high frequency. When you're very particular, we might notice it when it's initial. But otherwise, it may not be evident unless you do a hearing test. And usually elderly, it's the others who complain about the hearing loss rather than the elderly person himself or herself. Because when they might keep the TV at a higher volume, then the wife or the husband or the children might complain that you're keeping it loud, because they themselves may not realize it. Or when they're calling the person may not respond to it. And then they say, I called you so many times, you're not responding to it, or you're not addressing it. So that's how we realize that there is some hearing issues which is coming up.
Okay. Can you explain the effectiveness of hearing aids and other assistive devices?
So when you have nerve deafness, there's no other treatment for it other than using a hearing aid. A hearing aid specifically amplifies the sound and improves the hearing capacity. So, like in a specs, when you're buying a specs, you can't just buy any other specs and wear it because it may not be comfortable to you and you can't see clearly. Like that, for hearing loss, also, you need a hearing aid which has to be programmed according to your loss. So, because when you do an audiometry, there are various frequencies that we check from low frequency to high frequency. So, according to the laws, the hearing aid also will be programmed depending upon different frequencies and it will be catered to your need. And only that type of hearing aid you should wear. So, that will help in improving the hearing levels also and even understanding too. Because once you can't hear properly, you may not be able to respond to the person, or the child may not be able to study properly because it will just get amplified. It won't be comfortable to the person. So that's how a hearing aid helps.
How is hearing loss diagnosed in children and what are the available interventions?
So when a newborn child is born with a hearing loss, then there are certain tests which we do as a newborn hearing screening test, which is done, which is known as a OEE test, autoacoustic emission test. Here, this is a probe which you keep onto the ear canal and which will trace the readings. Because usually nerve cells will generate some waveform, some sound which is picked up in the ear canal. So if it is present, it indicates that the nerve is functioning properly. So that's the best thing for a newborn. If it is not seen, sometimes if the age-related response is not there, sometimes you might have to repeat it and see later on whether the child's nerves are starting to function. If it is negative, then we might have to do another test known as a BERA test, brainstem evoked response audiometry. In that, we look at the whole hearing apparatus itself, from the ear canal to the nerve to the brain, is traced properly to see whether it's functioning normally. This is for the very early life detection of hearing loss. In a child at a later stage, when they are 3 years or so, usually it's a behavioral audiometry what we do, where we make a setup in such a way that it's like a playful atmosphere and certain sounds are exposed to the child. So like something is ringing, so the child may turn to see whether the something means it can be a music type or a single tone. So by the activity of the child, we come to know whether the child has hearing loss or whether the child is normal. Slightly older child, we can do a regular audiometry, what we call pure tone audiometry, which is done in adults also, where different frequencies of sounds are given using a headphone, and then the person can identify, or we can get the levels of hearing and air conduction and bone conduction. So these are the common tests which we do to understand whether a person has hearing loss.
Okay. My last question is how does exposure to loud noise or prolonged noise pollution contribute to hearing loss?
So when we are exposed to loud sound, when we say loud sound, it means that when there's an 85 decibel hearing or level of noise, if you're exposed to 8 hours on a continuous basis, then the nerve will get damaged. That is a universal standard level which has been proposed. So above that, so when you say 85 decibel is the noise level in a crowded street or in a very noisy restaurant. Continuous 8 hours of exposure is going to damage the nerve. And above that, if it is 3 decibel increase, if we are exposed to just 4 hours of exposure itself can damage our nerve. So when you say noise levels, jet flying, it's about 120 dB what you call. or if there's a bomb blast, it's about 140 decibels. So the higher level, just 83 decibel itself in 4 hours can damage. So if it's say 120 decibel, that will be just a few second exposure also can damage. So normal speech or normal levels of hearing decibel is about 60 decibels. So the more the exposure, more the loudness, more the damage. So the nerve cells get permanently damaged, and that's what causes the hearing loss.
Okay.
So I think we should be very careful when you're getting exposed to loud sounds. And because everywhere it's so noisy now, our lifestyles have changed. On the road, people are honking. Without any reason, also people honk. That increases the ambient noise levels. Anywhere you go out, hotels, restaurants, pubs, school, function, anywhere you see, it is loud sound. So that's how it's going to damage our ears.
I have one more question, ma'am. So what about we are using earphones also, right? So that also causes, no?
Yeah. So earphone, the phones what you use, there are two ways it can damage. Not just the noise, but also the radiation from the. So both ways it damages the nerve cells.
Okay.
So we have to be very careful when you use it, and some listening to music or holding on to the ear, it's not a good idea. Okay, use it for a phone call, but then try to avoid as much as possible.
Thank you, doctor.
With
With this, we come to an end of today's live show. Thank you, viewers, for joining us. If you have any queries, you can leave a comment. Our expert will answer them for you. Thank you, doctor.
Thank you all.